Today we're going to talk about vulval skin disorders. They're a lot commoner than you might think, and many women would, I think, opt not to seek help because of lots of reasons, maybe embarrassment. So we've already talked about urogenital atrophy, which can cause changes to the skin. We talked about that in detail. It's also called vulvovaginal atrophy or genitourinary syndrome of menopause, and it's related to estrogen deficiency, which is most commonly in menopause. Other common skin conditions include lichen sclerosus et atropicus. It's also known as LSA, and it's actually really quite common, and it can affect both male and female, but it's commoner in females from birth to death. So children get it. It can cause itching, discomfort. The skin can become quite raw and painful. And there are a couple of other conditions which are similar called lichen planus. And lichen simplex. So lichen sclerosus and lichen planus are both of unknown cause. They're inflammatory disorders which are possibly linked to autoimmune conditions. So that's things like an underactive thyroid or B12 deficiency, vitiligo, where the skin becomes pigmented in a patchy fashion. So you can already see from the number of things I've mentioned that there are lots of potential causes, and just looking might allow a clinician, a doctor, a nurse, to be able to give an idea of what's wrong with you. But in order to make a clear diagnosis, a little tiny piece of tissue needs to be taken and sent off for histology. So I think my important message to you here is if you have a problem in the genital region, then go and see someone for help. And if your own doctor doesn't know or nurse doesn't know what the problem is, then there are specialist vulval clinics where they're set up to work often as part of a multidisciplinary team. That means that there may be a physiotherapist, a dermatologist, a gynecologist, so lots of different people working together to get the right diagnosis and the right help for you. Lichen simplex is a condition caused by scratching. And the itchiness can be caused by conditions like eczema, or it could be to do with a systemic illness, something that's wrong. Liver failure, for example, might cause itchiness, but there are a huge number of different causes. And my point is it might not be a local problem. It could be due to an environmental factor, so you might be putting something in the bath or washing with something which is irritating. And very, very occasionally this can be caused by an underlying psychiatric problem. So again, as you can see, even in this one small category, there are lots of potential causes. Now, many of these conditions, which we've talked about, will respond to treatment with steroid therapy. There are other ways of treating them. And so the diagnosis and the management plan are really important. Now, if you think about it, there are some common skin conditions which affect many people. Eczema or dermatitis is common, as is psoriasis. And both of these conditions can affect the skin in the genital region. So those are another two potential causes. And the one thing which we really want to avoid missing is cancer of the vulva. And that can occur, but in normal circumstances, there are precursor changes. So you will be familiar with attending for a cervical smear test to reduce the risk of cervical cancer. And the beneficial effects of smear tests are that we can pick up precancerous changes and avoid women developing cancer. Exactly the same thing applies to the vulva and also the vagina. And that's because these changes are caused by a virus called human papillomavirus. There are other kinds of cancer and there are other rarer conditions which affect the vulva. But I thought this morning's podcast would just raise awareness about common things. So let me run through those again. Lichen sclerosus et atropicus, LSA, lichen planus, lichen simplex, dermatitis, psoriasis, and precancerous changes, but they are a lot less common. And then there is vulval pain syndrome. That's a very disabling condition. It's embarrassing, and it's actually probably commoner than you think. There are lots of different causes, and I don't want to go into these here. I just want you to know that if you have pain in the vulval region down below, then go and see someone for help. As I said before, all of the diagnoses can be supported using a little piece of tissue, usually taken as a punch biopsy. That's a little core of tissue. That's taken after local anaesthetic is injected. The anaesthetic is uncomfortable, but the biopsy is not painful, and you don't require stitches. And at least you will know then what the problem is. So thank you for listening. I hope I've reassured many of you that might be suffering in silence that this is something which can be sorted fairly easily.